Hi, it's Dr. Erica Dickey coming to you from my home with an update on my boy Porter here. That's my orange tabby. You can see the tail of my other cat, Coco, who will also probably be in on the action from time to time. So Porter, he's my 16-year-old orange tabby. He was diagnosed with gastrointestinal lymphoma over 2 years ago via an exploratory surgery with biopsies of his guts. This happened after he became very, very ill, and I've been sharing my journey along with you on that. Today, I'm going to give you an update on everything that's happened since then. We're going to specifically focus on what's been going on at home with his symptoms, looking at goals of care in a palliative end-of-life journey with your pets, and how I've been managing him. We are also going to look at end-of-life decision-making tools that every pet owner should know. And this is something that is going to be key knowledge that's going to help every single pet lover. And then we are going to talk about real life situations, what's going on at my home that can influence and impact my decision making and my ability to care for my pets. And then if you stay tuned to the very end, I have some exciting news to share. All right. So, Porter. Okay, Coco, since you want to get in on this action, here you go, girl. Just over 2 years ago, Porter was diagnosed with gastrointestinal lymphoma, and that was through biopsies of his intestines. He also has generalized arthritis, which is mostly impacting so I'll show you here on Coco, which is mostly impacting his lumbar spine going into his hip area as being the biggest, sorest spots for him. And honestly, to be honest, I think that the arthritis is impacting his quality of life more so than the gastrointestinal lymphoma is, because it certainly has been maintaining fairly steady for a while. So the biggest symptoms that we see right now are that Porter is having some muscle loss on his body, which can be contributed to both the prednisone use and his just sarcopenia, which is a muscle loss with older age, and arthritis and kind of like disuse. So we're seeing that he is pooping outside of the box, and that was a problem for quite some time because he had diarrhea for a really long time. It was diarrhea outside of the box. So essentially we were lining underneath the litter with liners, and it was in the basement. So thankfully that situation wasn't a stopping point for our family. We talked about it as a family though, and how we were going to handle it. And we did decide that should Porter start having inappropriate poops, especially if they were diarrhea, outside of the litter box, anywhere else in the house, then that would be a stopping point for our family. And every family has their own stopping points as to how much they can bear to witness going on in their pets, and also what is going on with their pets and how it impacts not only their pet's life, but also the family's life. It is equally as important when considering end-of-life decision-making. So what do we do for Porter? Right now, he is on prednisone. I have that compounded into a liquid, prednisolone, sorry. I have that compounded into a liquid, and that is because cats are notorious for being very challenging in getting medications directly into their mouth. So I shake it up really good, and the great thing about medications that are in liquid is you usually have this little knob at the end that you can just directly attach the syringe, tilt it upside down, and draw up how much you need. So there's Porter's medication, and he gets that once a day. And then that is mostly for inflammation and for his gastrointestinal tract. So it benefits both his lymphoma and his arthritis. He also has gabapentin. Gabapentin is an amazing pain medication that essentially all animals should be on when they get to a pain level. And again, I've compounded that into a liquid specifically because he's a cat and he's very hard to pill, even for myself. So again, just drawing that up. And then these can be given directly into his mouth. I'd rather do them directly into his mouth rather on his food, because if I put it directly onto his food, number one, it's not guaranteed that he gets all of the medication, so he's getting a lower dose, which is not going to be as effective. Number two, he might start to have food aversions if we're putting the medication, which yes is flavored with chicken flavor, and you can get other flavorings, but there is of course a little element of bitterness and medication that they can taste. So not all pets are going to eat them up like maybe some dogs would. So for cats, I always recommend getting liquid medication and giving it directly into their mouth. And I do have a little clip on how to give directly into the mouth. If Porter comes back here, I will demonstrate. So those are the dailies. The other things that we are doing is vitamin B12 injectable, and that is something that I give to him at home about every 4 weeks underneath the skin. And the other one that we're doing is another injectable medication. It is a supplement called Cartrophin, and it is for joint health as well. And I'm giving that to him about every 3 weeks. I do notice when the 3 weeks taper off that I am starting to see a little bit more very, very subtle signs of his mobility issues. So for mobility, I'm noticing that he has a lot of hesitation when he goes to jump. He stumbles when he jumps up to higher levels. He's definitely, if the distance of his height, say, is from here or from the ground to here, he would previously, when he was healthy and wasn't experiencing as much arthritis, would just bound right up from the ground up. But now he's using the opportunity. He might even step it up onto this level first, then onto this level, and then to get to where his final destination is. And that's very typical and normal of arthritic cat behavior. And that is demonstrating a level of pain in his mobility. So what else can we do for cats with arthritis? Well, we can do anti-inflammatories. He is on the prednisolone, which I mentioned earlier. Because he is on a steroid, I'm unable to give him a non-steroidal anti-inflammatory. So basically, he is left with the prednisolone and the gabapentin as his main source of pain control. But what else can I do? Well, recently, maybe about a year or two ago, a new drug came on the market that has been changing the course of pain management for dogs and cats. For dogs, it's an injectable called Librela that's given monthly, and for cats, it's an injectable called Solensia, and it is also given monthly. So how amazing is that, to be able to go to your veterinarian or have a house call veterinarian service come out to you to give an injectable medication for pain that's going to last a month. So I thought, I am absolutely going to try this for Porter. Now on the label, it discuss that diarrhea is a common or is a potential side effect. And unfortunately, what do we do it 2, maybe 3 times just to give it for sure, is this cause and effect. Porter's diarrhea worsened after the Solensia to the point where it was completely flat and liquid, and that was not acceptable for our family. And so because of the adverse effects of the medication, in our family situation, we felt that that outweighed what potential benefits the medication was giving, especially knowing that we still had the gabapentin and the prednisolone on board. So in terms of creating our goals of care, I think for most people in any kind of pet palliative care journey, our major goal of care is to maximize our pet's comfort and also to be able to control pain to the best of our ability so that they can have the best quality of life. For Porter as well, because of our busy lifestyle and his kind of aversion to medications, we wanted to minimize the amount of medications that he was given on a regular basis or streamline them, prioritize them, so that we were able to continue to support the bond between myself and Porter. So I am the one that is giving the medications, and I want him to still want to come to me because that is his favorite source of joy. It's me. It's snuggling up with me around my head when I'm sleeping. And that is how I knew that Porter was sick for the very first time 2.5 years ago. One night, he didn't come to me at nighttime. And I checked in on him in the morning and I was like, Porter, buddy, are you okay? And he was just so flat. Like his head was just with his chin resting on the ground. He just looked so sad. All of his facial expressions just were screaming he was in pain and uncomfortable. And that is when the investigations started. So he's still now back to doing the sleeping with me all the time, his favorite thing. And I'm so happy that we've got him back to doing that. So what else do we do in his care plan? Well, behind me here, I have this device. It's from Assisi Animal Health, and it's a targeted pulsed electromagnetic field therapy. What you do is you just press this button, and underneath in here, I've got an open carrier that Porter loves to just climb into. His blanket is there, and underneath here, this is the mat. So that device up top is attached to this mat, and it's a 15-minute treatment. And he just walks in, and anytime we see him lying in the crate, we'll turn that on for him. He can get that treatment up to 4 times in a day to help with chronic pain management. And of course, sometimes Coco likes to go in there too. So we've played around with different things on this one, which is a very holistic approach. What it does is it helps target the internal cells for anti-inflammatory to kind of turn on inside of his body so that it is helping his body with pain on a full total body level. So it gets his guts, it gets his joints, it gets his skin and coat, everything when he is in a treatment for this, which is great. About 1 year ago, we reached a point where the diarrhea was so bad and he was starting to seem really unlike himself and lethargic. He did come to sleep with me at nighttime, but he didn't stay very long. And we were at a point where I thought, I need to bucket list. I need to figure out, what all I want to do with him before we say goodbye, because I thought we were really close. And one of the things that was on my bucket list, because pictures have always been very important to me in maintaining and helping me remember and keeping those memories alive. So I hired an end-of-life photographer who came into my home on short-minute notice, and she took amazing photographs of myself with Porter, of me and my husband Will with Porter. And we tried to get family shots too, but the kids weren't so much into it. And so we just kind of let that be because we were also at the same time preparing them that we might have to make an end-of-life decision for Porter. And because of what I do as an end-of-life veterinarian or hospice veterinarian, my children, who are 9 and almost 7 now, they do have a pretty good grasp of what a euthanasia means, why we do it, life and death, questions. We have very open conversations in our family, so we were sharing with them when we felt that Porter was doing unwell. Thankfully, I was able to get him into a local vet clinic who offers acupuncture. And we did acupuncture for him 3 sessions. The first one, he sat through it like a champ because he was unwell. He sat there. During that time, I was offering him Reiki. So I do have my level 2 Holy Fire Reiki, and I was just sending him as much, love and light, and let the energy that he needs go to where he needs it. And over that course of time, we continued on with his care plan, and he turned around, and we're so grateful and thankful that all of these opportunities are within our community and that they're out there and accessible. However, for the most part, we do try and keep as much care in the house as possible. So what does that mean? Am I going to the vet clinic for updating his blood work and finding out where things are at there? No, we're not. Am I doing vaccines for him? No, I'm not. And that's okay. That is part of creating an end-of-life or palliative care plan, knowing that preventative measures are no longer being addressed. Okay, I've got my dog here just like taking a full-on drink as I try and have this talk. So that's Ellie, my golden retriever. So we minimize those things. And now I think we're going to transition over to talking about the end-of-life decision-making tools that every pet parent should know. I'm going to start with, how do I know how much pain, or if my pet is in pain? There is this beautiful quality of life scale. We'll get to that in a minute. Pain scale called the BEAP or BEEP pain scale. It was created by Dr. Shay Cox, modified from a different pain scale that was available previously. But these have more parameters on them that are listed that are a little bit more easy for pet parents, pet caregivers to follow and understand. So what it looks at is it looks at specific behaviors or physical changes that you as the pet parent can see, and that is in the category of breathing, eyes, ambulation or how they're getting around, their activity, their appetite, their attitude, posture, and palpation or touch. And so that's where all of those letters, the first letters, start with that BEAP. So I filled this out. You probably can't really see it that well, and that's okay. I love this because it's color coded. It also gives visuals of the pets. It has specific instructions here based on their breathing. Is their ambulation like this? And so for Porter, we had breathing normally. We had eyes were maybe slightly more dull in appearance, a little bit held partially closed. For ambulation, we had hesitant to jump to higher places, may also not jump onto lower places, such as the couch or the bed. And then for his activity, we have him kind of in between these two categories, which is moderate pain and moderate to severe pain. So I just averaged that out. And then posture or palpation, I've got him as the between 2 and 3. And then touch. He doesn't mind being touched except on his painful area, where he'll turn his head to look when touched, and he does have some mild body tension that's present. So once you check mark off all these boxes in the various categories, it kind of gives you a visual to see where most of the check marks might be and what level of pain that is. But you can also write them down and then average them to get the pain. And for Porter, based on being on gabapentin 2 times a day consistently, his was 2.75 on average, and that was May 23rd of this year, 2024, that I did that. I use this scale as not only to assess and evaluate where he is at right now, but also to use to trend against himself. So this one was June 30th of last year, 2023. And I check marked all of those and got the average of 3. And that was when I was only giving gabapentin once a day. So what happened with gabapentin? Well, gabapentin, the reason why, going back then, what level of pain does that put him in? Based on his current pain control and being on pain meds, he still is between a mild to moderate level of pain, kind of gearing in towards the moderate. And you know what? I think that it is worth sharing that it is unreasonable to expect that you can get your pet who's been experiencing chronic pain down to a level where they're not painful, like 0 on the pain scale. Happy, healthy puppy, kitten. No, that's not going to happen. We have to adjust our expectations, and to know that he is on the lower level of the pain scale is important to me, because I have my stopping point based on how much pain I'm willing to tolerate or witness in Porter as he progresses along his health and life journey. And that is at the moderate to severe pain level at a 5 or 5.5. And he hasn't reached that except for when he needed his attention surgery-wise. But he hasn't reached that during our palliative journey, and so that's been amazing. While I have him here, I am just going to quickly give him his injectable medication, and you can kind of witness it while I do that. Oh, now he's trying to get into his carrier. It's just a second, buddy, just a second. So let's see here. Just stay, Porter. Oh, for goodness sakes. It is easier to do this with another person when they are trying to move. And now, of course, you can't see. So, Porter, stay here, bud. Good boy. Good stuff. So that was 1 injection. And then since he's still here, I'm going to give him this other injection. He tolerates the injections actually so much better than he does the medications by mouth. And that's because, well, the needles that I choose are really small. It's a 27 gauge needle, which is the same needle that people, you use for insulin, like super thin and tiny. And that's what every cat really should get. Just really minimize that first initial injection point. So you'll see here, he does not like this. So what I do for his medications by mouth is I do not have to physically open up his mouth. I am just parting from the side, hey bud, and getting him to open up his mouth naturally, with the syringe's help, and then squirting that medication in. So last one. There we go. And then after he gets his medications, I usually give him a little bit of a treat. So I am going to quickly just do that, and he runs away. That's pretty typical. Okay, so medications are in for the day. Let's go back to end-of-life decision-making tools. So now we know what level of pain he's in. What can we do? Do we need to make any adjustments to his comfort care plan, to his pain medications? What else, what can we do to improve his comfort? And knowing that potentially we might have maximized his pain medication options. So thankfully, the gabapentin medication can be given up to 4 times a day with veterinary guidance. And so we do have the ability to increase the frequency of his medication. There is a decent dosing range as well, so we could also increase the dosage that he gets. Other things would be things like in the home and in modifying the home environment. We got these stairs. I saw them at a consignment store, and I thought, okay, I'm going to get this and see, if it helps him to get up to our bed, which is higher, and that's his favorite spot to be. He never uses them. He like, and that's one of the things that happens commonly, right? You buy all these expensive things and tools and hope that, you know, your pet is going to use them, but there is no guarantee. Nope. So we've kept it in case he ever does decide that he needs it. The other thing that's happening with him is that he's no longer grooming, and so he's starting to mat as well. So I am helping him with a very soft rubber tip, because he is so painful on his back end, to really help get and release those the hair and the dander that starts to build up, and odor over time too. So I'm helping him with that. And so there are, you know, lots of ways, thinking about just trying to create those opportunities for lessening the step or lowering the height of a jump. So I have gone ahead and completed 3 different quality of life scales to kind of go over and show you the difference between some that are available out there. And honestly, for a quality of life scale, I would suggest you try multiples and see what resonates most with you. Oh gosh, here comes my girl, Ellie. She's gonna walk by here. There we go. Okay. So here is our, the one from Black Creek Mobile Vet pet quality of life scale that we created based off of the hospice, hurt, hunger, hydration, hygiene, happiness, mobility, and more good days than bad. So that can be called the scale, or the H5M2 scale. So I went through this, and I gave him a number out of 10, with 0 being unacceptable and 10 being ideal. And then it gives you a maximum potential score of 70. And his score was 52, which is 74%. And the recommendation here is that a total of over 35 points represents acceptable quality of life, or the suggestion to continue with pet hospice care and comfort measures. Speak with your vet further to optimize pain and symptom management. So that one was comforting to me to know that he was above the 35. Another one by Midtown Mobile Vet in Toronto, Dr. Faith Banks, has made another quality of life scale with 14 different kind of categories of life to consider in assessing quality of life. Oh, and there's Porter bunting my camera. And again, this gives a total score out of 70, which then you get the percentage in, and it gives a little bit more specifics in quarter percentiles. So that 25% or lower really indicates that quality of life is poor and euthanasia decision is imminent. That 26% up to 50% is, okay, we need to make serious adjustments to the pain medications and symptom management that we are doing, or euthanasia must be considered. And then, you know, above 50 to 75 is really that gray zone where it's like, okay, we need to look at palliative care for sure. What can we do to improve comfort? And then 75% or above is showing a decent quality of life with no obvious care required. So when I went through it for Porter, he got 54.5 out of 70, which was a 78% quality of life score on palliative care. So again, remembering that he's got all these measures that we're doing, and by doing these measures at home, the pain medications, the injectables, those things, I've been able to maintain an excellent quality of life for Porter. You know, again, very reassuring. It's not his time right now. This is another quality of life one specifically for cats, which was devised by Dr. Mary Gardner in the States. And it has different categories as well. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 categories. And then you're answering questions as often, sometimes, or not no or not applicable. And then you're tallying up the results. There's a specific instructions on how to tally up the results. And then it gives you the score interpretation. So Porter's was 11, which was in the 9 to 18 point category, which says that life quality is a concern and your veterinarian can provide guidance on how to treat or help manage your cat's symptoms. Yeah, because there are some concerns, and I wrote them down as I went through the quality of life scale. Like, well, what am I seeing? He seems sad sometimes. He's having accidents just outside the litter box. He's not grooming. There's a little bit increased smell. His breath stinks too. He stumbles and when he jumps up and going upstairs. So those are issues of concern. So talking about real life now. Real life. There is only so much every person can do. In our household, I am a mother of 2 young boys. One who is neurodivergent and is having some serious, concerns that we're working through together as a family. I am also neurodivergent and have to manage that, as well as chronic pain, which causes fatigue. And there's only so much you can do in a day. I'm a business owner and I'm busy. My household is busy, like most people's are. And so I have to realize that I can only do so much. And when I get to the point where what I can do no longer meets his needs, then maybe it is time to consider a euthanasia. What have I learned, and what am I sharing all this to you for? Some exciting news is that with all my certifications and my experience and what I've done for other families, I realize that we really need more education and empowerment in knowing that we can help our pets through this very difficult and emotionally challenging time of life for them and for us. And so I would like you to stay tuned and look forward to an upcoming course offering that I'm going to walk you through all the steps to gain confidence and peace of mind in your end of life decision making, so you can walk through the path of least regrets. I'm Dr. Erica, and this is Pet Comfort Vet. Thank you so much for staying tuned through this update on my palliative care journey with my boy,